Yeah, so status epilepticus has, in a way, slightly the same disappointment we have with epilepsy. Status epilepticus is obviously it's the maximal expression of epilepsy. It's prolonged seizures that don't stop. And certainly if they're convulsive seizures, they can go on to cause neuronal damage. And if you take people overall, somewhere around about 60-70% are going to be responding to the first-line therapies, so about 30% have refractory epilepsy, and those people end up in intensive care. And then at that point, quite a large number of those people will either be left with significant neurological deficit or will die. And so it's a really serious problem. Now, one of the advances that has helped enormously over the last 20-odd years is the use of emergency medication, things like buccal, Midazolam in the community. Very early on, the use of benzodiazepines by paramedics as well. And it's been shown over and over again, both in preclinical models, but also clinically, anecdotally, that the earlier that you treat and the more aggressively that you treat early, the better people do. So really, that treatment in the community and treatment by paramedics has been shown to have a marked benefit in preventing the consequences of status epilepticus. In terms of the treatments, when people get to hospital, there's been some very important, large randomized controlled studies that happened, that were reported and published in 2019. And the results, in a way, are a bit disappointing, which is that after you've given benzodiazepines, which are by far the most effective early medications, that it doesn't really matter whether you're giving Valproic, Levetiracetam, or phenytoin, they're all equally effective as second line, or as somebody may say, equally ineffective, because those people still continue to have seizures. And so what I think we need to be looking at are other ways to try and address the problem. And there are a number of studies looking at the roles of inflammation, breakdown of the blood-brain barrier, the formation of reactive oxygen species, and these particular targets that occur with continued seizure activity may be very important targets in preventing stopping the status epilepticus, in preventing the downstream consequences such as neuronal damage and neurological and cognitive morbidity, and preventing death. And a lot of those preclinical studies are very exciting. And I'm hoping that in the not too distant future, they will be translated into therapies for people in status epilepticus.